Do you struggle with neck pain specifically when you're sleeping, or find that you have increased neck stiffness when you wake up? Well, today we're going to discuss the top 5 tips that you need to implement in order to eliminate your neck pain with sleeping. Today's video is super important because not only will it decrease your neck pain and stiffness, it will also help you to improve the quality of your sleep. And as we like to say around here, when you're sleeping is when you're healing. So when you're able to get into that deep REM sleep, it will help you to be able to heal, which will allow the pain generator, or the thing that caused all this pain and stiffness to start with, to get better. So the importance of the quality of good night's sleep cannot be overemphasized. This is why I talk a lot about sleep on this channel. I talk a lot about sleep in the clinic. It is critically important to make sure that you're getting a good night's sleep so that you wake up feeling rested and ready for your day. Let's get into it. The first most important tip is that you need to keep your spine in a neutral position. So we're going to talk about all the different tools that you may require to get your spine in that neutral position. We're going to start up at the top of the head. The first thing you need to make sure is that you have support right here in your neck. So this little hole needs to be supported either on the side of your neck. You have one in the back of your neck too, in order to improve your quality of sleep and decrease your pain and stiffness in the morning. I use a pillow, it's called Pillowise, and it actually has a cutout that helps support this part of your neck. If you don't have a pillow like that, what you can do is roll up a small hand towel and place it underneath your neck. That will help to give you some extra support. Moving out from there, we need to make sure that this hole is supported. So making sure that your head is not sideways, too far down, too far up, depending on if you're a side sleeper, or even same thing if you're a back sleeper. It can be forward, it can be too far back. So making sure that this hole is supported as well is critically important. There are lots of great pillows out there specifically for that purpose, and I'll definitely link a couple of my favorites in the comments below. Now, moving down, ladies, many of us have a smaller waist than hips. So you may also need a pillow that's underneath your lumbar spine or in that curve of your natural waist to make sure that your spine is able to stay in that neutral position. And of course, ladies, again, looking at you, your hips are wider than your knees, which means you may need a pillow either in between your knees if you're sleeping on your side, or underneath your knees if you're sleeping on your back, to keep your spine in that neutral position. Now, I know that that sounds like a lot of supplementation and a lot of pillows that you're going to need, and you may not need all of them. Every body is different, but you should try using them and see which ones seem to be most effective for keeping you in a neutral position and decreasing your pain and stiffness. All right, tip number 2 is making sure that you have the right mattress and the right pillow. Again, it's critically important to make sure that our spine and our neck are properly supported throughout the night, because if we have improper support, that means our body is kind of stuck there for hours on end, which can cause ligaments to stretch out, muscles to stretch out, joints to get compressed, fascia to stretch out. This can lead to more inflammation with sleeping, which then our body has to try to process during the day. And during the day, our body is not healing. It's when we're sleeping that we're supposed to be healing. But if you don't have the right mattress and you don't have the right pillow, that can't happen for you. So I discussed earlier, the pillow that I recommend is the Pillowise pillow because it has that cutout here for your neck and here for your head and shoulders. However, you can also use that towel roll here and use a very supportive pillow here to make sure that you're properly supported. Now, when it comes to mattresses, I get asked all the time, what is the best mattress? The truth of the matter is, the best mattress for you is the one where your spine is in alignment. So I can't necessarily recommend a mattress specifically. However, what I will tell you is I sleep on a very firm mattress that has a pillow top on top of it. Because see, I'm a lady and I got hips. And if I try to sleep on a really firm mattress, my hip is going to start hurting because I can't tolerate that pressure for long periods of time. But if you put a pillow top on top of that, then I still have that support, but my hip can sink into that pillow top and kind of create a little bit of a space in there so that my spine stays in a neutral position. And I will tell you, we bought our mattress about 2 years ago. And when we did, I went to the mattress store and I laid on the mattress. And that can tell you a lot because I laid down on one mattress. I laid there for 5 seconds. Right away, my hip started hurting. I got up and I said, not that one. So pay attention to your body when you're trying out mattresses. You want your spine to be in a neutral position and you should not feel any pressure points, especially if you're only laying there for less than 5 minutes. Tip number 3 is one that I cannot say enough. You have to avoid stomach sleeping, especially if you have neck and shoulder pain. Stomach sleeping is not good for anyone. However, if you're already having neck pain, every time you go to sleep, you are putting more strain on the ligaments, more strain on the muscles, more compression on the joints, and stretch on that fascia, which is only going to increase your pain. Plus, you're staying in that position for a prolonged period of time, which does not give your body the time to heal that it requires. I know it can be hard if you've been a stomach sleeper for years and years to change your position, but I really need you to work on this. You're going to see the benefits of it. For my patients who have neck pain, the best position usually is side sleeping. Of course, when you're side sleeping, you need to make sure that you're filling in the different holes to make sure that your neck is in a good position, as well as that lumbar curvature, as well as that pillow between your knees to make sure that your entire spine is in correct alignment. But side sleeping is the easiest way to make sure that your head is staying in the correct position all night long. If you have a good pillow and you have a good mattress support, it makes sure that even when you flip over to the other side, you're still as supported as you should be. But if you find side sleeping to be difficult, then tip number 5 is for you, my back sleepers. Again, you want to make sure that the curve of your spine is supported. But for you, that towel roll that you're going to use probably needs to be about a half rolled up towel roll, because in general, the curvature on the back of our neck is not as big as the curvature on the side of our neck. You do want to make sure that your head is supported in a neutral position, and that's different for everyone. So for some people, I've had them use just like a feather pillow. They just need something very, very thin because their head is in alignment with their spine. However, I had one patient who was extremely kyphotic and he was stuck in that position. He required 2 pillows in order to make sure he was in the proper position. Now for my back sleepers, I need to make sure that your lower spine is in the correct position as well, including your SI joints. So for you, I'm going to recommend that you take those pillows and you put them underneath your knees so your knees are supported in a slightly bent position. Some people, 1 pillow is enough. Some people need to fold that pillow in half. Some people need 2 pillows to make sure that their hamstrings are unlocked, there's decreased tension through their SI joints, and there's no pain through their low back, especially if you're a back sleeper and you tend to stay there most of the night. So there you go. If you have neck pain, there's the things that you should and should not be doing to help eliminate your neck pain. Now, over to you. Drop a comment below and tell us what you've done to eliminate your neck pain specifically with sleeping. And if you have any questions about this video, drop that in the comments below and we'll make a video especially for you.